science,
engineering,
medicine,
chemistry,
physics,
biology, humanities, cardiology,
computing, public health, global
aeronautics, science communication.
Hello everyone, I'm Gareth Mitchell, and if there's one word that sums up most of our topics today, it's crisis. In this edition, crises in air quality, opiate use in the UK, and the link between the climate crisis and that in mental health. And also, author Angela Saini has been on campus talking about her book on race and science.
So my union, the National Union of Journalists, considers me a black member because I am non-white. So politically, anyone who wasn't white, at least in the 80s and 90s, was considered politically black. That would make me white, brown and black all at the same time. And that's how arbitrary these categories really are.
Well, first we're going to have some news. Kate Whiten joins us for the first of these two stories. And Kate, can we start by talking about this study into the air quality, or maybe lack of it, in many of London's green spaces? What's this about?
This is a new analysis of annual air quality levels in, as you said, green spaces across London. It's from Imperial College and University of Leicester, and they specifically looked at levels of nitrogen dioxide and compared those to the safe limits of this compound that are set by European Union and the World Health Organization. And they found that more than a quarter of London's parks, playgrounds and open spaces actually exceeded these safety limits for nitrogen dioxide. And this is important because nitrogen dioxide is a compound that's linked to lung conditions such as asthma. It's something that it is important to keep below those limits and is emitted from vehicles as well as things like wood-burning stoves.
Right, so this is obviously not great news, but how is the team responding to these findings?
Well, they've worked with a few other organisations and they've produced a website where people can actually log on to and check their local parks for levels of nitrogen dioxide concentrations. If people go to the online story on the Imperial College website, they can click through to that website, and that's where you can find all the various green spaces mapped along with the corresponding levels of nitrogen dioxide. And the researchers, as well as doing that tool, are just using this as another kind of building block in this campaign to really help get London's air cleaner, and adds to this quite big weight of evidence that shows that air pollution in our capital is still pretty poor. And this is particularly important, obviously, because looking at green spaces and playgrounds is where children obviously go, and they're particularly vulnerable to the effects of air pollution.
OK, so to look up your local park, as you were suggesting there, Kate, go to the news story on the website imperial.ac.uk/news, and people can click through and get those findings, can't they?
Absolutely.
All right, Kate Whiten, thank you very much for that. Well, it's here now from Hayley Dunning, and you're going to tell us about krill. This is an interesting old study, isn't it? Tell me more.
Yeah, so you might not think much about krill, other than you might vaguely remember they're the things that whales eat. So krill are little crustaceans. They can grow to about 6 centimetres, but they swarm in absolutely huge swarms, particularly in the Southern Ocean around Antarctica. But a researcher at Imperial now has been looking at what their role is actually in global climate. So krill eat phytoplankton, which are a kind of algae, and those algae perform photosynthesis. So in that process, they take carbon out of the atmosphere. And when the krill eat them, they then poo them out. And those poo pellets are rich in carbon, and that sinks to the bottom of the ocean and locks that carbon away. So krill are actually quite important in the global carbon cycle and therefore the global climate.
Oh, OK. So they're sequestering carbon effectively. What do we know, or what does this study tell us then about the effect of harvesting krill?
Yeah, so it's interesting because krill are harvested not only by the animals that eat them, whales, seals, penguins, but also by humans. We do fish them for fishing bait, for aquaculture, and also some pharmaceuticals and dietary supplements. Now, the fishing industry isn't massive. It's actually reasonably sustainable, but the researchers stress that we really should take these effects into account when we're trying to figure out how to manage these fisheries. And the effects are quite complicated. There's other questions about whether, if whaling is less, does that make more krill, and does that make all this better? And there's lots of interconnected effects that need a bit more research, but the the researchers are saying this is enough to say, hey, we should really look at this.
And I know that they are saying we need more research, as you might expect. But do you have, Hayley, by any chance, any fun krill facts to share with us?
Well, I said that krill are abundant. They go in big flocks. They actually are probably the world's most abundant multi-celled animal. So they can go in these huge swarms up to 20 kilometres and contain up to 3 million tonnes of animals, which is 30 trillion individual krill. The researchers have studied them, and their genome is 12 times the size of human genome. And they also glow in the dark. They have a form of bioluminescence.
Yeah, well, there we are. In praise of krill. Perhaps we don't praise krill quite enough on this podcast, or anyway. Hayley Dunning, thank you for that. And also thanks to you, Kate Whiten. Well, now, recent government findings here in the UK say that too many patients are potentially being prescribed addictive medications, and for too long. And that brings to mind the crisis across the Atlantic, where opiate use has been linked to thousands of deaths there and has led to multi-million-dollar lawsuits against drug manufacturers. The problem here in the UK isn't quite that bad, but could things escalate to levels approaching those in the United States? A team of Imperial medics has been crunching the numbers and looking at the changing trends, as Ryan O'Hare has been hearing from Dr. Richard Pinder of the School of Public Health.
Well, I think the good news is that we're nowhere near the levels of misuse and addiction that we see in the United States. And I'm actually quite optimistic personally that because we don't have the same incentives that they have in terms of fee per payment and incentives for physicians to prescribe these types of drugs, I don't think we will get to the stage that they have in the United States, but that doesn't mean that we don't have problems.
Okay, so that's quite reassuring then. But you look at prescribing trends in pain medications, and you had a paper out which actually seen a change in pain med prescription. Can you tell us a little bit about that?
Sure. So quite a lot of work over the last several years has focused on what we call opioids and those drugs that you mentioned that we've seen in the United States.
And these are the drugs such as OxyContin, which most people would know.
Correct. Absolutely. And whilst we've been taking a very careful watch in the United Kingdom on those drugs, and we've actually seen some improvements in some of those types of drugs, so benzodiazepines and some of the opioids have all seen reductions in their total volume of prescribing on average in the UK over recent years. I've been particularly interested in trying to figure out whether there are any increases and substitution effects of different types of drugs that historically we've considered as less worrying. And those are two drugs in particular, pregabalin and gabapentin, which collectively we call the gabapentinoids.
And what are these? For people who aren't familiar, what are these two drugs, pregabalin and gabapentin?
Well, they have historically been actually developed to use in the treatment of things such as epilepsy, but also generalised anxiety. But increasingly they've been used for something which we call neuropathic pain. And whereas pain for opioids is often used in cancer therapies and in treating post-surgical wounds, pregabalin and gabapentin have increasingly been used for people with chronic pain conditions. And what we're increasingly seeing, or what we think we're seeing, is that GPs are trying to shift people from these opioid-based medications, which we know are extremely potentially harmful, onto these gabapentinoids, which we think are less harmful. My worry over the last several years has been that actually we're seeing huge rises in those particular drugs without that depth of understanding as to what dependence and risks might come about from using them so much.
So is there any evidence that these drugs are as addictive as opiates or less addictive? And what sort of trends have you seen then?
We certainly do see some level of dependence forming. Now, whilst that dependence may not be as strong as it is for opiates, and whilst it may not be quite so harmful as those opiates, we're certainly seeing what we call diversion beginning to happen, which is where people use entirely lawfully prescribed medications and pass them on either to friends, relatives, or people who might pay money for them. We've seen that happen in codeine and a few other drugs. And we're certainly seeing increasing levels of actual abuse in our prison populations and in other areas where some of those other drugs are actually just very difficult to get hold of.
So your studies looked at a few years' worth of data and the changing trends. How does the increase in these two drugs compare to, say, increase in opioids then?
Right, so the work that we've done here in the School of Public Health observed reductions in the opioids that we've been particularly concerned about, and also the benzodiazepines over the last several years. But what we're seeing on the gabapentinoids is that actually they're bucking the trend. And we're seeing between 1.5 to 2 times increases in the volume of prescribing, or at least dispensed prescriptions, over these most recent 5-year period, which we cover in our study.
So I guess the key question is why? Why this increase in this class of drugs then?
Well, I think some of it is caused by the ageing population and the fact we have more people who are being diagnosed with neuropathic pain, which is an entirely appropriate use of this drug. But what we did identify was that actually the ageing demographic is not accounting for all of this increase alone. And what we suspect is happening is that certainly there is increased awareness of GPs appropriately prescribing the drug so that more people who need it and who stand to benefit actually receive it. But there is probably also some level of substitution effect that's going on from the pressure that we're placing to reduce tramadol and our weaker opiates, and that is shifting some of the utilisation towards the gabapentinoids, possibly in the absence of that full understanding and awareness of the potential harms that can come about.
So should doctors and the NHS and indeed the public be concerned about this rising trend then?
Well, the first thing actually I should say at this point, Ryan, is that if any of our listeners are using these drugs, that they absolutely mustn't discontinue them without first discussing with their physician, because it's really important. We do see withdrawal effects, particularly for people who've been on high doses for a longer period of time. So it's really important that people don't discontinue them by themselves. But I think we should be concerned, though. I don't think we'll necessarily see greater harm come about from the pregabalin and gabapentin use on an individual patient level. But the risk is that we see far more people using these medications for very long periods of time, and therefore whilst the harm from these gabapentinoids may not be as significant as it would be for opioids, at a population level, actually this could be a problem.
So for GPs and for the NHS more widely, what's the solution to this? What sort of steps can the healthcare system take?
Well, I think first of all, prevention. What we want to do is we want to promote social prescribing, we want to promote social inclusion so that we can most appropriately obviously treat the pain, but also try to reduce harm where actually that balance between risk and benefit isn't necessarily paying off right now.
Richard Pinder speaking to Ryan O'Hare. Well, now the link between two other crises, the climate crisis and mental health. Here's Caroline Brogan.
As the ongoing climate crisis deepens, so does its impact on our physical and mental well-being. But what can we do when we feel helpless against a seemingly insurmountable problem? And how does this and the physical effects resulting from more heat, drought and natural disasters cause anxiety and trauma in both adults and children? I spoke to Dr. Emma Lawrence at Imperial's Institute of Global Health Innovation about the mental health effects of the climate crisis and how we can tackle this new public health hazard.
There's both direct effects of climate change on mental health, things like if we have more natural disasters, forced migration, people losing their livelihoods. But then there's this other side that's coming into society's awareness that people talk about as climate change anxiety, that's fear of impending ecological doom that comes from sort of knowing the facts about climate change, maybe feeling a lack of control over what's to come. And it can mean different things for different people.
So what does this impending sense of doom look like? How would it affect someone's behaviour or mindset?
For some people, it could interfere with sleep. It could link to obsessive thinking, fear or anger that's interfering with daily life. But many people describe it as this inability to kind of let go, fear or thoughts about what's to come, and then that not enough is being done. This is interesting because it's, a rational response to the fact.
How does that compare with more organic mental health issues like anxiety for no tangible external reason? Does that change the way that you would approach helping these people?
Sure. So first of all, I should preface this by saying I'm not a clinician or a psychiatrist. I'm approaching this from a very much a research academic perspective. It's still unclear whether it's affecting people who are vulnerable to feeling anxious in general, or for how many people this is something that's really distinct and separate. But I think what's important is that we realize that this is something that's going to be collective for societies to have to sort of adapt to the changes. But what people say is helpful is the things that also nicely link to supporting positive action on climate change in general. So there's really this nice duality there that actually talking to people, working out what you can control versus what you can't control, and being able to take positive actions that make, know that you're making a difference. But we can see in regions that are really impacted by climate change already, for example, Greenland, there's been really big mental health implications, or communities have been devastated by wildfires and floods. floods and hurricanes. And with more natural disasters, that comes with more trauma, PTSD, and other mental health implications, and implications for communities with forced migration, drought. It's a big problem for farmers in Australia, of increased risk of suicide. And also, most people don't know, but if you're on medication that's for many psychiatric illnesses, some of those medications actually affect your body's ability to regulate temperature. We're trying to understand the evidence base that exists in general, and also working with the Grantham Institute to then understand what are the policy implications, how can we raise awareness of these issues.
Just thinking more of people at home listening to this, I know I get anxiety related to climate change. I just wondered if you could offer some tips and advice on how to manage that day to day.
If it's something that is really negatively affecting someone's life, approaching, medical and professional mental health support is definitely what I would recommend. Ways that they might manage anxiety in general, whether through exercise or making sure they're getting enough sleep, talking to their friends, all of those things still apply. But then in this particular case, I think that I've found it really helpful to talk to other people who might be experiencing these same things, and we can sort of also use that as fuel and how we can take action, but in a way that protects from burnout as well. You can go from ignorant to overwhelmed, but there's sort of this middle ground where helping people decide what does it look like to take action for them that's in line with their skills, with their talents, with their ways of being and doing in the world, and sort of settling on that thing that, like, this is going to be my way of processing this. But recognizing also, if you're going into burnout, that maybe you need to step away from reading the news for a while, or it's okay to also protect yourself.
How would a parent best address anxieties or sadness related to climate change for their children?
There's a bit of an intergenerational divide sometimes of parents sometimes feeling like it's their job to tell the children it'll all be okay and make those anxieties go away. The advice I've seen psychologists give, and again, I'm not a medical professional, is to, instead of trying to sort of dismiss these worries, to actually really acknowledge them and understand where they're coming from, and ensure that your children really know to, again, like, take action together, and what concrete steps can you take as a family, but also to help them understand that it's not up to them to shoulder the entire burden.
Awesome. Thank you so much, Emma, for speaking to me.
Emma Lawrence talking there to Caroline Brogan. And do remember, there's help and support for those affected by mental health crises here at Imperial. We have the Student Counselling Service and mental health first aiders on campus. If you'd like more information, we've put some links up for you from the story that accompanies this podcast on our news website. And on a national level, by the way, you could call the Samaritans, text SHOUT to 85258, or visit a walk-in centre. And of course, if your life's in danger, then do call 999. Well, finally, let's hear from the writer and journalist who's white, black and brown. At least those are all racial categories in which Angela Saini has found herself through her career as a journalist and in researching her book Superior, The Return of Race Science. The book explores just how arbitrarily society categorises race and how that and science intersect today. Angela has recently been on campus here at Imperial giving a lecture on that very topic. Our reporter Martha Nahar has been speaking to her.
When I was at university, I studied engineering and I got involved in anti-racism movements. At that time, it was quite a big issue because the Stephen Lawrence murder had happened just a few years before, and he was actually killed not very far from where I live. The BNP bookshop was in the same town where my school was, so we were kind of acutely aware of just how important it was to fight against the rise of racism and fascism. And when I got to university, I got involved in those movements, and that's how I started writing for the student paper. And if I hadn't done that, I wouldn't be a journalist now. I would have gone and been an engineer. So in some ways, it's an issue I've been turning over in my head for my entire life.
How did you find the process of researching and writing the book? And was there anything that you learned about yourself while you were doing this?
For me, I really wanted to answer questions I'd had for a long time around what is race really? What is the basis of it biologically in our bodies? We use these categories all the time, socially and politically, and, we tick the census forms and we feel that we know who we are. But there's so much kind of messiness of thinking around what that actually means in terms of genetics, and real biological human difference. And I think what writing Superior gave me was clarity. I never really had clarity on those things. And it really kind of swept away the messy thinking and helped me see race for what it really is. In that sense, it was really cathartic, I think, writing it for me, because for so long we live with these stereotypes about who we are. Now I understand that they really have no basis.
You said an interesting point there. You said you've started to see race for what it really is. So can you expand on that a little bit and tell us what you mean by that?
Race has a lot of social value. We use it in our everyday lives, and it also has a huge impact on our bodies, on our minds, because of racism and discrimination and the history of how we use these categories. Biologically, genetic difference maps very poorly onto these social categories that we use, to the point of almost meaninglessness. And their invention, we don't always realise, was actually really arbitrary. For example, take the word Caucasian, which is the kind of label we use to politely describe white people now. Well, Caucasian, when Johann Friedrich Blumenbach in, I think, the 18th century developed this idea, essentially all he did was look at the skulls of different people, saw that the people from the Caucasus had the most beautiful skulls, and then decided to define Caucasian as everyone from Western Europe to Northern India, which would make me Caucasian by that token, because I'm from Northern India. And that was the definition for a long time. But now it certainly doesn't include me because I have brown skin. It's used as a euphemism for whiteness. At the same time, now union, so my union, the National Union of Journalists, considers me a black member because I am non-white. So politically, anyone who wasn't white, at least in the 80s and 90s, was considered politically black. That would make me white, brown and black all at the same time by all these different definitions. And that's how arbitrary these categories really are.
What is your advice for any academics who might be designing studies that touch on or cover race?
I do look at modern day scientists and how they use race, sometimes very inappropriately in their research and sometimes without really being able to define it. So I would say, my view on academic freedom is if you can get your work peer-reviewed and funded and published in a reputable journal, then do whatever kind of work you want. But if you're going to use race as a variable in your research, then you should at least be able to define it, biologically define it. If you cannot define your variables, then the question is, what are you using them for, and what use do they have?
Why should people read Superior? What would be the one key takeaway for them?
Well, I think we live in this age of identity politics. There's a huge rise in ethnic nationalism now. I think especially with Brexit, we're all questioning who belongs and who doesn't belong. Where do I place myself in this firmament? What I hope is that readers get from Superior what I got writing the book, which is an understanding of what identity really means and how to contextualise it, and to understand that actually we are all remarkably similar underneath, and that these ideas that we have that are fueling the rise of the far right and the alt-right right now, that are fueling ethnic nationalism, populism around the world, that they are exploiting what they believe are scientific ideas for their racist and political purposes. I'm hoping that it undermines that for the layperson.
That's Angela Saini speaking there to Martha Nahar. And there's an extended version of that interview on Imperial College's SoundCloud channel. To find that, go to SoundCloud and search for Imperial College. And for some reason, it works best if you search for Imperial College, all one word. And then you can track down that interview along with lots of other good stuff, including news stories, other interviews and previous editions of this very podcast. And whilst I'm giving you different ways in which you can listen to us, we are also on iTunes, Spotify, YouTube and even Entail. We do visual podcasts over there, so do check that out. But for now, whatever platform you're listening to us on, we are going to call it a day, but I'll be back next time. Thanks for listening. I'm Gareth Mitchell and goodbye.